NCLEX RN practice questions. Management of care. 20 questions. Test your knowledge. Question 1. A charge nurse is making assignments for the upcoming shift. Which client should be assigned to a newly licensed RN? A. A client 2 days post-op with a new tracheostomy requiring frequent suctioning. B. A client with stable chronic heart failure on oral medications. C. A client in acute respiratory distress requiring BiPAP. D. A client with new-onset diabetes experiencing diabetic ketoacidosis. The correct answer is B. The stable chronic heart failure client has predictable needs appropriate for a new RN. The other clients require more experienced assessment and intervention skills. Question 2. A nurse witnesses a colleague taking medication from the medication cart for personal use. What is the nurse's priority action? A. Confront the colleague privately about the behavior. B. Report the incident to the charge nurse or nurse manager. C. Document the incident in the colleague's personnel file. D. Wait to see if the behavior happens again before taking action. The correct answer is B. The nurse has a legal and ethical obligation to report suspected substance abuse to protect client safety. This should be reported through proper channels immediately. Question 3. A client refuses a prescribed medication, stating, "I don't want it." What is the nurse's best response? A. You have to take this medication. It's doctor's orders. B. Can you tell me why you don't want to take this medication? C. I'll document that you refused and notify your doctor. D. This medication is important for your recovery. The correct answer is B. Exploring the client's concerns demonstrates respect for client autonomy and may reveal misconceptions that can be addressed. Clients have the right to refuse treatment. Question 4. A nurse is preparing to delegate tasks to unlicensed assistive personnel, UAP. Which task is appropriate to delegate? A. Initial assessment of a newly admitted client. B. Administration of a PRN pain medication. C. Measuring and recording vital signs on stable clients. D. Teaching a diabetic client about insulin administration. The correct answer is C. UAP can perform routine tasks like vital signs on stable clients. Assessment, medication administration, and client teaching require nursing judgment and cannot be delegated. Question 5. A client tells the nurse, "I don't want my family to know about my HIV diagnosis." The client's spouse asks the nurse about the diagnosis. How should the nurse respond? A. Your spouse has HIV. You should ask them about it. B. I can't share that information without your spouse's permission. C. Let me get the doctor to speak with you. D. As the spouse, you have the right to know the diagnosis. The correct answer is B. HIPAA protects client health information. The nurse cannot disclose the diagnosis without the client's explicit consent, even to family members. Question 6. A nurse manager notices that several medication errors have occurred on the unit over the past month. What is the best approach to address this issue? A. Discipline the nurses who made the errors. B. Conduct a root cause analysis to identify contributing factors. C. Require all nurses to retake medication administration training. D. Implement a policy of double-checking all medications. The correct answer is B. Root cause analysis examines systemic issues rather than focusing on individual blame. This quality improvement approach identifies underlying problems to prevent future errors. Question 7. A client is scheduled for surgery and the consent form is not signed. The client states, "I don't really understand what they're going to do." What should the nurse do? A. Explain the procedure to the client and obtain the signature. B. Notify the surgeon that the client needs more information. C. Have the client sign the form and document the concern. D. Ask a family member to sign the consent form. The correct answer is B. Informed consent requires that the client understands the procedure. The surgeon must provide this information. The nurse should not obtain consent if the client doesn't understand. Question 8. Which situation requires the nurse to complete an incident report? A. A client refuses morning medications. B. A client's foreign infiltrates and needs to be restarted. C. A client falls while walking to the bathroom unassisted. D. A client's family member is upset about care. The correct answer is C. An incident report documents unexpected events that could result in harm, such as falls. This is for quality improvement and risk management purposes. Question 9. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with COPD with oxygen saturation of 88%. B. A client with diabetes reporting a blood glucose of 250 milligrams per deciliter. C. A client post-op day 1 reporting pain of 7/10. D. A client with chest pain and shortness of breath that started 5 minutes ago. The correct answer is D. New-onset chest pain and shortness of breath suggest a potentially life-threatening cardiac or pulmonary emergency requiring immediate assessment using the ABC's priority framework. Question 10. A client asks to see their medical record. What is the nurse's best response? A. I'll need to get permission from your doctor first. B. You have the right to access your medical records. I'll help you with that. C. Medical records are confidential and can't be shared. D. You can only see your records after you're discharged. The correct answer is B. Under HIPAA, clients have the right to access their own medical records. The nurse should facilitate this request through proper hospital procedures. Question 11. A nurse discovers that the wrong medication was administered to a client 30 minutes ago. What is the priority action? A. Complete an incident report. B. Assess the client for adverse effects. C. Notify the nurse manager. D. Document the error in the medical record. The correct answer is B. Client safety is the priority. The nurse must immediately assess the client for any adverse effects from the wrong medication before completing documentation. Question 12. Which task can the nurse safely delegate to licensed practical nurse, LPN? A. Developing the nursing care plan for a newly admitted client. B. Administering oral medications to stable clients. C. Performing the initial admission assessment. D. Teaching a client about a new cardiac diagnosis. The correct answer is B. LPNs can administer oral medications to stable clients. Initial assessments, care planning, and complex teaching require RN-level judgment. Question 13. A client with a DNR, do not resuscitate, order goes into cardiac arrest. What should the nurse do? A. Begin CPR immediately. B. Call a code and start resuscitation efforts. C. Provide comfort measures and notify the provider. D. Ignore the DNR and follow the family's wishes to resuscitate. The correct answer is C. A DNR order must be honored. The nurse should provide comfort care, ensure the client's dignity, and notify the provider. The family cannot override a valid DNR. Question 14. A nurse observes another nurse documenting care that was not provided. What should the nurse do? A. Ignore it since it doesn't involve their own practice. B. Report the behavior to the appropriate supervisor. C. Confront the nurse privately and ask them to correct it. D. Report the nurse to the State Board of Nursing. The correct answer is B. Falsifying documentation is a serious ethical and legal violation. The nurse must report this to protect client safety and maintain professional standards. Question 15. A client with a language barrier needs to sign a surgical consent. What is the most appropriate action? A. Have a family member translate the consent form. B. Use hand gestures and simple words to explain. C. Obtain a certified medical interpreter. D. Have the client sign and explain later. The correct answer is C. A certified medical interpreter ensures accurate communication for informed consent. Family members may not translate accurately and have potential conflicts of interest. Question 16. The nurse receives a phone call from someone claiming to be a client's physician requesting confidential information. What should the nurse do? A. Provide the information since physicians have access rights. B. Verify the caller's identity through a callback to a known number. C. Ask the caller for their medical license number. D. Transfer the call to the nurse manager. The correct answer is B. Identity verification is essential to protect client privacy. The nurse should call back using a verified phone number to confirm the caller's identity before sharing information. Question 17. Which scenario represents appropriate professional boundaries? A. A nurse accepts a gift from a client's family valued at $100. B. A nurse provides their personal cell phone number to a client for questions. C. A nurse declines a client's invitation to attend their family gathering. D. A nurse shares personal financial problems with a client. The correct answer is C. Declining social invitations maintains appropriate professional boundaries. The other options cross professional boundaries and could compromise the nurse-client relationship. Question 18. A nursing assistant reports to the nurse that a client is requesting pain medication. What should the nurse do? A. Tell the nursing assistant to give the medication. B. Assess the client's pain and administer medication as needed. C. Document that pain medication was requested. D. Ask the nursing assistant to assess the pain level first. The correct answer is B. Pain assessment and medication administration cannot be delegated. The nurse must assess the client and determine appropriate intervention. Question 19. During shift report, a nurse realizes the previous shift's nurse made an error in documentation. What should the nurse do? A. Correct the error by erasing and writing the correct information. B. Contact the previous nurse to make a late entry correction. C. Ignore the error since it wasn't made on their shift. D. Draw a single line through the error and initial it. The correct answer is B. The nurse who made the error should make the correction through a late entry. Each nurse is responsible for their own documentation. Question 20. A nurse is assigned to care for a client whose cultural practices conflict with hospital policy. What is the best action? A. Explain that hospital policy must be followed. B. Ignore the policy to respect the client's culture. C. Collaborate with the interdisciplinary team to find a compromise. D. Transfer the client to another facility. The correct answer is C. Culturally competent care requires finding solutions that respect both client values and safety standards. Collaboration often reveals creative compromises. How many did you get right? Comment your score below. Subscribe for more NCLEX prep.